Healthcare in the U.S. is changing. Across the country, healthcare systems are being pushed to evolve, to improve outcomes, control costs, and ensure that everyone is as healthy as they can be. But there's a problem. Healthcare systems weren't designed to make people healthy. They were designed to treat illness, and health is much broader than the absence of disease. Social, cultural, and political factors have a bigger combined impact on health than the clinical services hospitals provide. Healthcare is changing, but to create health for everyone, communities must change as well. In Jackson, Michigan, this small city is meeting the moment with a big idea. Jackson is home to the Jackson Care Hub, a best-in-class community information exchange that bridges the gap between clinical care and social support. It's an integrated referral network that connects healthcare providers and social service agencies, ensuring people get the care they need when they need it. Because when we are sick, we need doctors, nurses, and medicine. But we often need a lot more. The conditions in our lives, our homes, our schools, our neighborhoods, have a profound impact on health.
75 to 80% of your health outcomes are based outside of your visit with your provider. They're not clinical in nature. They're more to do with your behavior management, things that you do to take care of yourself. And then also a large chunk, 50% or more, is related to whether or not you have the resources.
This is a new reality for healthcare. For decades, fee-for-service has dictated how healthcare is delivered, rewarding quantity over quality, and focusing on disconnected, episodic treatments. And the results are clear.
The fee-for-service model led to the most expensive healthcare system in the world with very average outcomes. So if you compare us to other economically developed countries, our health outcomes are about twice as expensive as the average, but below average in terms of outcomes. So we look at life expectancy, infant mortality, things like that.
By addressing social needs alongside medical services, the Care Hub reflects the growing, urgent shift toward holistic, integrated, community-centered care, which is what patients need.
If we're not looking at the whole person and addressing their mental health, their emotional needs, and their social needs, you're not going to see the same outcomes.
Stable housing, food security, reliable income. Without these basic human needs, illness rates rise, life expectancy drops, and healthcare costs skyrocket for patients, hospitals, and communities. To succeed in the new landscape of value payments and risk sharing, healthcare needs new adaptive tools, ones that connect the clinical issues affecting patients with the social conditions shaping their health. The Jackson Care Hub creates this connection. Our best in-class system is already working, bringing clinical and social services together through a coordinated IT platform and an aligned partner network. We're creating direct referrals for clinical patients to social services. We're collecting data about community conditions that make us sick. And we're creating actionable analysis to support a long-term change in systems. Because the future of health isn't just healthcare.
The doctor's appointment isn't necessarily the top thing on your list if you don't know what food you're going to have for dinner or where you're going to be sleeping.
The Care Hub has created this elegant, centralized way to then navigate people in our community with needs to the resources in the community that can meet those needs.
It really helps to close the loop on those referrals so that the people aren't just sitting out there kind of hanging and we say, we made the referral, but we don't know if they ever get there. With the Care Hub, now we do.